It has symptoms like daytime sleepiness, heroic snoring, observed episodes, especially by the spouses, when during sleep suddenly the patient stops breathing for some time. Now, snoring and obstructive sleep apnea are two different things. Snoring can be present in simple airway obstructions of the nasal passages anatomically, but obstructive sleep apnea has a different area. It is a soft tissue problem. It's not a monotonous snore, but a snore that peaks in volume and then suddenly you have cessation of silence. Then again, there's a increasing volume of the snoring till again you have another sequential silence. So this kind of snoring is the dangerous snoring. Hi friends, welcome back to Dr. Gladson Explains. I am very thankful for the overwhelming response I have received from all you people. We had earlier expected around 3 to 4,000 people to see my videos, but I was pleasantly surprised when I saw more than 17,000 people have viewed my videos, and I have received lots of comments and encouragement from all of you. So today we are going to talk on another topic, a very important topic called obstructive sleep apnea. Obstructive sleep apnea is defined as episodes of partial or complete upper airway obstruction associated with decreased blood oxygen saturation or arousal from the sleep. This is a relatively new condition. Basically, we have been forced to look at this condition as our colleagues, our anesthetists, cardiologists, gastroenterologists, psychiatrists, and even bariatric surgeons have been pointing out that something in our field is causing problems in their fields. So that is how we came across this condition. It has symptoms like daytime sleepiness, heroic snoring, observed episodes, especially by the spouses, when during sleep suddenly the patient stops breathing for some time. Awakening in the morning with a parched throat, sore throat, or acidity or heartburn, like GERD like symptoms. So it can be misdiagnosed for GERD. Now, GERD, you can look on the corner there, you'll get a description for the link to the other video I had posted earlier. Now, you could also have morning headaches, mood swings, trouble focusing during the day. Sometimes people have been, having high blood pressure, and even sometimes decreased interest in sex. So all these symptoms are very vague and bizarre, but then they are ultimately, this is a lifestyle disorder. And I had mentioned that one of the set of doctors that approached me were bariatric surgeons, because yes, one of the common comorbidities in this condition is obesity, and it is this lifestyle where fat starts depositing in different parts of the upper airway, which causes the choking of the patient, and that is what causes this problem. Now, snoring and obstructive sleep apnea are two different things. Snoring can be present in simple airway obstructions of the nasal passages anatomically, but obstructive sleep apnea has a different area. It is a soft tissue problem, and it may not be, there won't be any obstruction of airway when you are awake, but when you are asleep, when you have no conscious control over your airways, that is when you choke. And so your breathing patterns is not a monotonous snore, but a snore that peaks in volume and then suddenly you have cessation of silence. Then again, there is a increasing volume of the snoring till again you have another sequential silence. So this kind of snoring is the dangerous snoring. And like I said, we have been prompted by our cardiologists because these have led to cardiac diseases. The stress has led to GERD, so gastroenterologists have been prompting us. So this is when we have come into this field, which was earlier the domain of the respiratory physicians. So they've been practically doing sleep studies and giving CPAP machines, but then CPAP machines don't work in everybody. There are quite a few comorbidities in this condition, like GERD, obesity, type 2 diabetes, hypertension, heart disease, anxiety, and depression. In addition, this is a chronic condition, so it needs lifestyle changes such as weight loss, increase in physical activity, quitting smoking and alcohol abuse. If untreated, there is a very low life expectancy. Studies say that if detected before the age of 50, it's between 8 and 18 years. The diagnosis, like I told earlier, sleep study is one of the first things to be done. Sleep study can be quite expensive if done in a hospital, so I prefer to get it done sending my technician across to your home, where he fits you with the device and your sleep is analyzed on your bedside. This is not only more economical but more representative, as we know exactly you are most comfortable in your own bed, and that too in your side of the bed. Second, you have got other things like imaging, CT scans, MRIs, sleep MRIs, then drug induced sleep endoscopies. All these will give us an accurate diagnosis of your condition. Now, as I was talking to you earlier, there's a device called CPAP, continuous positive pressure oxygen therapy. Basically, in this, we put on a mask, it could be a nasal or a mask, where high pressure air is sent into airways, so that if there is a soft tissue which is blocking, that is kept open. But then it has its own drawback. In certain conditions where this fat deposition is happening lower down, say in the tongue base, you could actually not be tolerating CPAP. So ultimately, the solution is surgery. Sometimes surgery is not just done for the upper airways. At the same time, maybe the bariatric surgeon, if you've got morbid obesity, you will have to go in for bariatric surgery along with this. So these are decisions that you have to take, and unfortunately in our country, where Mediclaim has still not covered it totally, only the high-end Mediclaim policies accept this condition as it is. As I told you, a lifestyle disease, it get denied. People avoid the moment we say surgery, they avoid it, but then they pay for it with their lives. So I wanted this video to come to you so that you become more aware that it's a very dangerous condition, and sometimes surgery is the only choice available to you, and you must take it with both hands. And let me remind you, surgery gives you a small window where you are able to exercise and you are able to oxygenate yourself and burn the calories, so that you never develop this disease again. And for that, you must alter your lifestyle. So all that and more will come again. There are future episodes which I'll be explaining more about this. So thanks again for all the attention you have given to me, and I hope you will keep supporting me and helping me continue this series of ENT issues that I am highlighting to you. And please comment, share, and follow my videos, subscribe to it, and also tell me what more you want to know in ENT, what you want me to come up, which topics do you want me to explain further, and I'll definitely try to help you out. Thank you.